Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. Let's review the CPT codes used to report this service. 73010, Radiologic Examination, Scapula Complete. This code applies when imaging of the scapula includes a complete radiologic exam. No minimum number of views is specified in the code descriptor. Scapular radiographs include focused views designed to evaluate bony injury or alignment, especially in trauma cases. Each view offers a different angle of key scapular landmarks such as the glenoid fossa, coracoid, and acromion. Grouped by clinical focus, standard views, scapular AP view, captures the body of the scapula, glenoid neck, and axillary border. Scapular lateral Y view, essential in trauma protocols to evaluate dislocations and coracoid-acromion alignment. These are typically the two most common views in a standard scapular series. Radiology report example, order exam scapula complete, right. Header, AP, and scapula views of the right scapula, history, fracture. Comparison, CT chest, abdomen, and pelvis from 1/7/2023. Findings, inferior scapular body fracture shows normal healing. Impression, inferior scapular body fracture with normal healing. Let's look at the views. AP view, lateral Y view. That's a total of 2 views. This qualifies for CPT code 7010, Radiologic Examination, Scapula Complete. Now, let's choose the appropriate diagnosis code based on the clinical history and chart findings. Report findings state, the patient has a known inferior scapular body fracture on the right. This follow-up radiograph is performed for continued evaluation, and the current images show the fracture, and comparison confirms the prior injury. Important guidance. The anatomical site is the body of the right scapula. There is no documentation indicating whether the fracture is displaced or non-displaced. Per ICD-10-CM official guidelines section 9.C19.C, if displacement is not specified, we must code it as displaced by default. This is a follow-up exam, so we use the 7th character D for subsequent encounter during routine healing. The most appropriate ICD-10-CM code is S42.114D, displaced fracture of body of right scapula, subsequent encounter for fracture with routine healing. Correct codes for this report are CPT 73010, right radiologic examination, scapula complete, and ICD-10 S42.114D, displaced fracture of body of right scapula, subsequent encounter for fracture with routine healing. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content. CPT is a registered trademark of the American Medical Association, AMA. CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines. Verify all codes with the most current CPT code set and payer policies before claim submission.